Hello, I'm Dr. Sonal Asthana. I'm a senior consultant in hepatobiliary surgery and multi-organ transplantation at the Aster Integrated Liver Care Program, Aster Hospital, Bangalore, India. So, pediatric liver transplantation is a very rewarding but relatively underserved area of transplantation across the world. Across the world, we have seen the numbers of pediatric liver transplant rise because of more effective diagnosis of pediatric liver disease, congenital liver diseases that are picked up early. In India, the trend that we see is that diseases present very late because of a lack of diagnosis at an early time when diseases can potentially be avoided. And the second problem that people face is money, affordability of a transplantation. For that reason, India does less than 10% of the number of transplants that could potentially be done for saving for children with liver disease. Yeah. The challenges can be broken up into diagnosis, access, counseling, and affordability. Diagnosis is the first one. Most pediatric liver disease or liver diseases that require children to have a liver transplant are genetic in origin. The commonest disease is something called biliary atresia, which involves the non-development of bile ducts in a child. These diseases can be picked up relatively early and relatively inexpensively with screening programs. But unfortunately in our country, we do not have established screening programs for these diseases. So what happens is that most of these children are not diagnosed on time. For the example that I gave of biliary atresia, which is the commonest cause of transplantation in children, most of these children, if they are picked up early enough, can undergo a relatively smaller procedure that would avoid or delay the need for a liver transplantation. But in India, most children present at a stage at which point this procedure is not possible. So early diagnosis is one thing, that is with the use of screening programs that could actually change the scenario. The second thing is effective counseling. Uh, People are seen day in and day out by pediatricians working in different parts of the country, both urban and rural. Unfortunately, most doctors themselves are not aware of the technology and the facilities that are available to transplant very small babies. So often patients or parents who present to their own doctors for advice do not get adequate advice because of lack of general information about the facilities that exist. Third is counseling. Whenever a child falls ill or whenever a child is unwell, parents, it's a very traumatic time both for the child as well as for the parents. Most parents require some help in coming to terms with the diagnosis and understanding the magnitude of the clinical challenges. So parents will generally look at a transplantation and they will need to understand what needs to be done in order to take care of the child after the child has had such a major procedure. So the lack of any coordinated effort in this fashion leaves most parents unprepared for the magnitude of the surgery or the challenges ahead of them. Subsequent to this, a lot of parents, they give up, they lose hope, and they do not take their child forward for access to treatment. So again, as we estimate that approximately anywhere between 5 to 10,000 children require transplant every year, but the number of transplants that are done in India are less than 150 to 200. So we are barely scratching the surface of what is required for transplantation in our country at this time. The Aster Integrated Liver Care Program has been set up as an index program which is focused on an anatomic specialty, that is liver disease. So it involves surgeons and medics working together in coordination, dealing with all aspects of liver disease. So this is fairly unique because normally we find that surgeons, medics, and different medical professionals work separately, and patients have to go to each specialty in rotation. But in this situation, we find that all the specialists actually come together in order to deal with the patient with a particular kind of problem. So apart from surgeons, medics, we have anesthetists, critical care people, counselors, nutritionists, physiotherapists, coordinators, who all come together in order to provide the care that patients need. So Aster Integrated Liver Care Program is also different in which we care deeply on how we can help our technology and help our skills reach people who are most in need of it. So this is what we talk about last mile connectivity in healthcare, because we know that there is a substantial amount that has already been done in healthcare which can actually benefit so many people if it is made accessible to them. So one of the areas of our focus is on how our skills and the facilities that are available can be made to people who are most at need, regardless of cost. And many of the initiatives that we have taken forward actually reflect this particular ethos. So, firstly, we would like to talk a little bit about our affordable liver transplant initiative. We realized fairly early on that although there were several children who were coming forward who needed a liver transplantation, many children chose to not go forward with the liver transplant with the primary requirement that of a lack of money. Now, children are an interesting group to transplant. They are a very rewarding group to transplant because once we do a transplant for a child can grow up into a healthy, normal human being and live a complete life with a liver transplantation. Secondly, in children, usually one of the parents is a match as a suitable living donor. So we do not have a challenge in finding donors who are suitable for a parent. It's a relatively safe operation for a parent because a very small portion of the liver can be removed from the parent and would be appropriate for the child. So often the only thing that limits access to transplantation for children is actually the lack of money. Um, this was one of the children that we had transplanted very early on in our careers had presented to us with acute liver failure, which is a condition that requires a transplant within 5 to 6 days. Her father was a foundry worker in a factory. He earned 7,000 rupees a month. And as it happens, we got an organ that was appropriate for that little girl and we transplanted her. And then we realized that there was a substantial amount of money that was required in order to take care of the child. So at that time, we reached out to several organizations, and then we came to understand that it would be possible to raise money to support children like this. So moving forward, we were fortunate enough to work with two excellent groups, that is the Praveen Agarwal Foundation, Shri Praveen Agarwal ji, as well as the Milap Foundation, which is focuses on crowdfunding for children with illnesses. So working together with these really improved our vision, our worldview significantly, mainly because Mr. Agarwal is a rare, entrepreneur philanthropist who comes forward with a singular focus on improving health disease. We know that some of the most successful philanthropists like Bill Gates, come from a similar mold. They come from a corporate mindset and they bring a certain amount of governance. So the structure that was set out by the Praveen Agarwal Foundation as a partner in order to create a foundation for affordable transplant initiative worked very well. With this structure, we have been able to offer transplantation to children and families for a cost of 2.5 lakh rupees only. You can compare it to the cost of transplantation, which are anywhere between 20 to 25 lakhs otherwise. So families would need to pay only about 10% of the cost of such a transplant, and the rest of the cost is usually picked up by a combination of donations from the Praveen Agarwal Foundation as well as crowdfunding initiatives from Milap, which is our crowdfunding partner. So far with this, we have managed to successfully transplant 38 children in the last 16 months with using funds that have been raised from the crowdfunding platform as well as through the Praveen Agarwal Foundation. So this program, this is very niche and very unique, and as we said, it is very, very fortunate that we got a mixture of a clinical team like ours, which had the passion and the commitment to deliver the service. A visionary philanthropist like Shri Agarwal, who was able to give time, not just money, but also put in a structure in place which maximized the potential for this. And a partner such as Milap, which has created a unique crowdfunding platform which raises money for worthy causes through social media. So we were able to get together and provide niche care that is required for these children. Now the question is, how do we scale it? How do we make it better? Right now it's not enough. We know that only 1 in every 10 children who require a transplant in India actually get it. So how can we make it better? The first is by identifying children who are most at need. So the first biggest thing that we can do in order to improve the lot of children is to pick them up early and identify children who are most in need of transplant. We should make sure that there is a mechanism for identifying these children. These mechanisms are inexpensive and they can be put in place by good public health systems. Second is counseling the doctors, making sure that doctors in our peripheries, doctors who actually are the front line, the doctors, the nurses who take care of our patients, are trained to identify these patients early, offer the parents the solutions that they need, and provide the support that they need at a traumatic time in their lives. Okay. Thirdly, making sure that there is an effective referral system. So as of now, we have a number of programs in the country that are offering pediatric liver transplantation. They are still relatively few, but there are a few high volume centers. There are probably less than 6 to 7 centers across the country that do more than 30 pediatric transplants per year. So the mechanism of referral, putting a system in place where children are identified early, counseled appropriately, and referred to the appropriate place for treatment would actually make a very big difference. The fourth is scaling this program. How do we make sure that this kind of initiative is available to all? The first is that if more sort of business houses, more corporate hospitals join together along with the Praveen Agarwal Foundation to increase the size of the corpus, that would make a significant difference. We know that the government has mandated that companies set aside a certain percentage of their profits as a part of a CSR initiative, and that would be something that we would be very keen to explore, because that would significantly increase the corpus that is available to transplant children such as the ones we were talking about.